Here to answer your questions is Dr. Daniel Kritzkis, Chief of Infectious Diseases at the Brigham. Dr. Kritzkis, thanks for being here.
Well, good evening, Erica and Ben. Good to be with you.
Good to see you, Dr. Kritzkis. All right, so far, this variant has only been detected in a small number, very small number of patients in the city of Marseille. Have you seen any evidence yet that it might spread?
We've not seen evidence that it might spread. I think the key here is that it's small numbers, and that's what makes these variants so challenging. We keep identifying new variants of coronavirus, but we can only know once things have taken off that it's going to be a problem. And fortunately, this one, which was identified even before Omicron, really hasn't gone anywhere, which is good news.
Okay, well, hold on to that. I know your focus, of course, right now is on the current surge from Delta, but really more so Omicron. What can you tell us about the patients that you're admitting at the Brigham?
Well, we've had quite a surge. We now have close to 90 people on the general medical floors and around 15 or 16 in the intensive care unit. But that ratio is what's really key. Back at the beginning of the epidemic, we had 80 to 100 people on the floor, and we had around 80 people in the ICU, all on ventilators. And now it's only 20% of that, which means that Omicron is probably less virulent, but also people are better protected than they were when we first started back in 2020.
Well, that certainly is a bit of good news. Well, as you well know, most of the vaccinated patients who test positive experience only mild symptoms, maybe no symptoms at all. But the CDC guidance for those people, I'm going to be candid here, it's kind of been all over the place for the last couple of weeks. 10 days isolation, 5 days, test, don't test 2 days in a row. The tests don't work that well. So what do you want folks to know about isolating if you do come down with COVID?
So if you come down with COVID, whether you're vaccinated or not, you need to isolate. You should isolate for a minimum of 5 days. And after 5 days, you can go about your business so long as you're masked. You need to avoid doing things where you have to be unmasked, like eating in restaurants or going to a bar, and you shouldn't travel as the CDC has recommended. Ideally, you would get a rapid antigen test to confirm that it's okay for you to be out. If you can't get that test, then you absolutely need to be masked. And probably still best, if you're not able to test and you can't mask, then you really should conform to the full 10-day isolation. And then remember, it's 10 days after or 5 or 10 days after your symptoms have gone away.
And let me just follow up, though, on that quickly. So let's say on day 5 or day 6, you do a rapid test, you feel better, and it's positive. You're saying even if you feel better and the symptoms are largely gone, you should keep isolating. And how much longer should you keep isolating?
Well, so you could test every day, and then once you're negative, then the next day you'd be okay to go back to doing what you're doing, but still with a mask. That's, for example, the policy we have in our hospital. If you couldn't test again, then give yourself the full 10 days.
Wow. Okay. And now we do want to get to a viewer question at this point. Sarah writes, does double masking offer the same protection from COVID as an N95 or a KN95 mask?
We know that double masking is much more effective than single masking. There are studies that showed that. The N95 or KN95 masks are still more effective because they don't have the problem of these openings at the side, but they're really hard to wear for a long period of time. And so except for, healthcare workers or first responders who are in direct contact with people with COVID, I think that the typical person is much better off with a double surgical mask than trying to go around with an N95 mask all day long.